Hello, and welcome to Let My People Eat, a podcast that provides satisfying talk about kosher nutrition. Here we clear through the clutter of nutrition speak, arm you with the clarity and confidence to eat, feel, and be your healthiest every day. I am Jill Sharfman, a board-certified holistic nutritionist living in Los Angeles.
And I'm Dr. Andrea Moskowitz, a neuroscientist and psychiatrist in Los Angeles. I use my training and experience to integrate positive lifestyle changes into my patients' lives.
Hey, Andrea.
Hey, Jill. How's it going?
It's going well. So, do you know that I am a certified lifeguard?
No, I didn't know that.
So let me tell you the story about that. So I grew up in Pittsburgh, and our original school building was somewhere called the Hill District. Anybody who saw the TV show Hill Street Blues, that's where it took place. And it was an old Russian bathhouse. They eventually sold that building and moved into the Jewish community suburb of Pittsburgh, Squirrel Hill. But we were in that building, and our PE was swimming because there was a huge, scary pool in the basement of that building. And twice a week, that was our PE.
Okay.
So we were always, twice a week, we went in, got into our bathing suits, did the swimming. And as I got older, one of the things they had us do was become certified lifeguards. And as part of that, I had to take CPR classes and learn first aid. And obviously, my certification is no longer valid, but I do remember a lot of the things that I was taught. And I was just curious, did they still teach first aid in schools?
I think it depends on the school. Some schools do. I know of a couple. I don't know in the Jewish
Right. I don't think our girls at EULA did they?
No, I don't think so. I know some of the other private schools even require people to get lifeguard certification.
Right.
Or pass certain swimming tests. There's just, it's very variable. Let's put it that way.
And I find it so interesting because it's so important that you learn basic first aid.
Right. And I know like in our community, they have sometimes in the summer done classes where they teach girls for babysitting purposes, right? Like basic first aid skills and basic CPR.
Right.
And
so,
also choking, what to do in choking.
Yeah. So I remember that when I was pregnant with Ariana, who was my oldest, we were living on the Upper East Side at the time. And Aubrey and I went to a baby CPR class. Right. And it was Aubrey and myself and a bunch of nannies who were there, which I think is important, but it was very interesting. Yeah. So today's episode is going to take place in two parts. We have two guests today. Our first guest is Rachel Freier, also known as Ruchie by her friends and family. Ruchie graduated Touro College with honors and attended Brooklyn Law School part-time so that she would have time to study law while raising her 6 children. She was elected as civil court judge in November 2016 and was recently honored as one of Brooklyn Law School's trailblazers for being the first Hasidic woman to be elected to public office. When a group of Hasidic female emergency medical technicians in Borough Park asked Rachel to assist them in their desire to serve other women during emergencies, her offer to help them mushroomed into directing a global grassroots all-women's volunteer agency known as Ezras Nashim. In order to be a more effective leader, she became an EMT. Hi, Ruchie.
Hey, how are you?
We're good. Thank you so much for joining us. So I know at this point, Ezras Nashim is endorsed by a lot of prominent Rabbanim, which is great, but it wasn't an easy road to get there. There were a lot of people in the beginning who opposed this being set up.
Correct.
So can you tell me a little bit about that path?
So I got a lot of pushback out in the open, and then I got a lot of support behind the scenes. And I realized that this was really a political issue in the Frum community, where it really boiled down to politics and control and kind of how let's leave things the way they are. If it ain't broke, don't fix it. And then I also learned that there actually was a movement to have a women's division of Hatzalah, which dates back to the early years of Hatzalah back in the 1970s and 1980s. And once I was just doing my research and I got all my evidence together and I was just digging, I realized that this is a cause that I have to really devote myself to because this is the right thing. And if I wouldn't be, let's use the word like naive in the sense that if this is what Hashem wants me to do, I'm going to do it. And once I'm on that mode, I'm on that road, you're not stopping me, because it's not about a dream that I have. It's about something that I think is what Hashem wants me to do. Mm-hmm. And Hineni, I'm here to serve. And that's really how I got so invested, because it really shook me to the core that there are Abanim, Gedolim behind the scenes endorsing me. And yet there seems to be pushback. And it's just such an inaccurate picture of what's really going on.
Right. So in Israel, it's the opposite. I mean, Hatzalah does have a lot of female members in Israel. So was Hatzalah not open to having females on the team that they could call up if they needed to?
Well, that's how we really got started. I was called by a group of women who had been trained originally to be part of Hatzalah's women's division back in the 70s. And when that didn't work out back then, they kind of disbanded because they were forced to disband. And then when the Rebbe in New Square integrated women in Hatzalah of New Square, this goes back around 10 years ago, even a little bit longer, that's when these women started to get together again and say, hey, maybe now's the time to get the rabbis from Brooklyn on board and follow the lead of the Square Rebbe. And someone told them, if you want to get your project off the ground, you need a female attorney who's going to help you pro bono. And they got a list of some from female attorneys, and I was one of the names on that list. And that's how I got invested in this, involved in this. And that's when I said, if I became a lawyer just for this cause, and it was worth going to law school. Uh-oh. And it kind of like took me by storm, because it went to the core of what I think a Jewish woman is. I think that God created us with incredible ability and capabilities. We have Bina Yasera. We have so much that makes us unique and special, that when it comes to helping other women through medical emergencies, that's our role, which we're reclaiming. I'm not here to make anything new or start some sort of a revolutionary movement. I'm going back to the way it was supposed to be. Mm-hmm. Somehow along the way, things got muddied in the waters over here. But this is the way Hashem wants it to be.
Right. It goes back to the times of Shifra and Pua, who were the midwives who took care of everyone. And a lot of the members that are trained as EMTs for Ezras Nashim are also already nurses and doulas and labor coaches, and they're already in that field. So up until this point, the women in the Jewish community only had two options. Either it was to have maybe a male Hatzalah neighbor show up and help them in a compromising position, or to go outside the community. So this is why you started and helped and started building Ezras Nashim. And it's, a very, very noble cause.
When you're giving birth, you know what happens. And trust me, when I come to a scene, and sometimes people would call both, or sometimes there are from Hatzalah guys already on the scene, I say, God is my witness. This is not appropriate. Right. From men can do a lot of mitzvahs, but this is one mitzvah. I think it's our mitzvah, and I'm here to reclaim it and proudly say it. We are capable. And if you believe that Hashem runs the world, you do what's right, no matter what the oppositions will say. They can come with their arguments time and time again. And I'll tell them, Hashem runs the world. And Hashem gave me this opportunity to fix something that has to be fixed. And I can tell you, Baruch Hashem, we've seen incredible success. Just having members like Charna, and we will at one point say, we are just as good as anybody else. And at some time in the future, they're going to say, really? I mean, there was a time when you called men to deliver babies, when you have from women. And I can tell you that in our group of Ezras Nashim, we have so many smart women with professional degrees that I think we out-degree most of the other corps that try to compete with us. And we're not here to compete. But if you wanted to put all of our degrees on a piece of paper, you'll be amazed at who these women are. I am so proud of our volunteers, incredibly talented, gifted women who are here to give and serve, whether they're OTs or PTs or RNs or PAs. And for the very young members that come, Ezras Nashim has been a springboard. Mm-hmm. Women have come in and gone on to nursing school, considering medical school, and I encourage that. because they're learning that the medical field is open to the frum female population.
That's amazing. So tell me, what's next? You have the ambulance now. Is there something that you've set your sights on to accomplish next with Ezras Nashim, recruiting more women?
Yeah, there's so much more that we can grow. There's just so many paths for us to take. I'd like to see us recruit more women and have the ability to train more, do more, respond more, and just to grow. I just dive into Hashem that He guide us in the right direction, because let me tell you, it's very challenging building an organization. It's really something that requires so much siyata d'shmaya, because we couldn't do it without the support of the many, many people out there who support us.
That's right. Any last minute thoughts that you'd like to share with our audience?
All I want to say is that when you want to do something and you want to do something that's good, you need to know it's going to be hard and it's going to be challenging, but that shouldn't stop you. It shouldn't stop you from whatever dreams you have. I have so many people who say, oh, Ruchie, I'd love to join, but I'll never finish the course. And you know what? It says in the Mishnah, Lo alecha hamlecha ligmar. Some people will not start because they're afraid they're never going to finish the task. But it continues, V'lo ata ben chorin lihi batel mimena. You're not absolved from even starting and trying. You don't know what your potential is. Just believe that Hashem can help you. Pursue your dreams. And whether you want to become an EMT and a paramedic and an RN, fine. If it's something else, that's fine too. What I've learned from Ezras Nashim, because I never thought I had a medical component to my brain. I was just law and order. And I was pushed out of my comfort zone because I was provoked. The worst thing that these men did was tell me that I can't do something because I'm a frum Hasidic woman. They pressed the wrong buttons, because I believe that Hashem gave us the Torah that recognizes women and gives us the strength that we need to run our families and run our homes. And if you could do that, you could do anything. So believe in yourself, believe in your Bina Yisera, believe in the fact that you're created in the image of God, B'Tselem Elokim, and you will be successful.
I love this. It's so inspiring. Yeah. I'm going to play this over and over again. I think it's great. Thank you so much, Judge Freier, for joining us. We really appreciate it. And it's just amazing what you're doing. Maybe LA will get their own division someday. And we just wish you lots of hatzlacha going forward.
Thank you so much.
Okay.
Perfect.
Okay.
It was great meeting you.
Nice meeting you.
Nice meeting you too. Thank you so much.
Thank you.
My pleasure. All the best. Hatzlacha Rabbah.
Thanks. You too.
Bye-bye.
Our second guest today is Charna Goldsmith. She is an EMT and a trained instructor with Ezras Nashim. She plays an integral role in recruitment and ensuring that all members are up to date on requirements. She lives with her children and husband in Brooklyn and uses her spare time to make wigs for cancer patients. Hey, Charna.
Hi, Charna.
Hi, how are you?
Good. So how did you get involved with Ezras Nashim?
Completely by accident. I was looking for a chesed opportunity, and I had posted on a few chats that I was looking to help people. And somebody messaged me asking me to basically join this ambulance corporation. And I was like, ambulance medicine? And this person kept messaging me. I had no idea who the person was. Finally, I messaged Ezras Nashim. I got involved. And then the person who had originally suggested the idea thought they were talking to somebody else with the same last name. So I kind of fell into place by mistake.
It was hashgacha pratis, I guess, that you got involved. Yeah. So what we want to talk to you about today is basic first aid that people should know in their homes. We'll talk a little bit about when you should be calling, 911 or Ezras Nashim, or when you need professional help. But there are a lot of things that can be done, in the home that a mom or a dad should be aware of. So first of all, we want to talk about the primary goal of first aid. There are 3 Ps: preserve life, prevent further injury, and promote recovery. So there are some medical conditions that you need to help take care of the person until professional help arrives, right? So what might be some of those?
Okay. I mean, that's like a very broad question, but basically, the first thing that comes to mind is CPR. CPR is something that needs to be done depending on if you witness a person fall or child fall. It needs to be implemented right away. And having that skill on hand to be able to perform CPR enables you to do it immediately without having to wait helplessly for an EMT or a paramedic or EMS to come on scene.
Right. So there's hands-only CPR, yep. Right? Can you give us just a brief description? You place both hands on the center of the chest.
Well, okay, so that's going to vary for child to adult, but for an adult, you would place both hands basically on the sternum, which is the center of the chest. And, people don't know this, but you're actually going to feel the bones break underneath you. CPR is only done if the person is not breathing and there's no pulse. Right. So obviously you only want to do this in a very short, extreme circumstance. And at that point, you want to press down hard enough that you're going to actually feel their rib cage collapse. And that's going to allow the proper amount of pressure for the blood to pump through the heart. Because what you're doing in CPR, hands-only CPR, is you're actually acting as an artificial pump for the heart and the body to have blood circulate around.
Right. Yeah, go ahead.
So speaking of that, since it's very important, obviously, before you start this, to make sure that the person indeed does not have a pulse, where are the best places for people to check for pulses?
You're going to want to check on the neck. While you're there, you're going to check for chest rise and fall, any signs of breath. And really, if you can't get on the neck, you're going to check on the wrist. If you happen to have a pulse ox, you could put it on if you're really unsure. But you want to make sure that the person is definitely not breathing or anything like that and does not have a pulse.
So the trick is, and one of the things they taught us when I was in high school, is that you compress the chest to the beat of a song like Staying Alive by the Bee Gees, because you want to get a certain number of compressions in over that specific amount of time.
It is 30 compressions for an adult.
30 per minute.
So it's 30 compressions, 2 breaths, 30 compressions, and that's sort of the cycle that you do. If it happens to be that it's not a relative and it's not something that you would do mouth to mouth and you don't have the proper gear, then you would just simply keep doing the chest compressions.
Got it. Okay. Other medical conditions where you should treat them as emergencies are when there's a strain in brain function, things like weakness, numbness, vision loss, dizziness, confusion. Breathing problems would also be something that you would want to call in professional help, and of course, heart problems, stroke, heart attack, things like that. Okay, so when you come on the scene, Charna, when you're called, first thing is you check the scene for danger, right?
Yeah, scene safety.
Scene safety. So if there's falling debris, if there are wires down, if there's anything that could pose a danger to you or the person you're treating, you want to make sure that's okay. You call for medical help. Okay, you're there. And then provide care. So these are all things that you're trained to do for professional. But a lot of times we're going to talk now about the minor injuries. Okay. So let's talk about minor cuts or scrapes.
Sure. I would just, I would say that the majority of EMS calls happen to be what you would consider minor, which I don't think a lot of people realize. I think people, think that EMS and EMT, it's like a life or death situation, but we get a lot of burns, a lot of cuts, falls, ticks, tick removal, something that we've had to deal with. Interesting cases that you would really never think about. And as a parent or, just a person, no one should ever overthink calling for EMS or 911 or help or anything like that.
That's so important. Okay, so if either you show up or a mom's at home and her child suffers from a minor cut or scrape, how should they treat that injured area safely?
So that depends if there's any broken bones associated with it or sprains and things like that. But
so we'll get to sprains and strains in a minute, but this is just basic, they cut it. It's more than let's say a scrape.
So you definitely want to take into consideration the area, in which you're being cut. If it's a head injury, if it's a knee, if it's a hand, something like that. Every parent and household should have a good kit at home, first aid kit. And you want to disinfect the area. You want to make sure there's no glass, debris in there. You want to take into consideration that any cut on the head or face, it's going to bleed a lot. There's a lot of blood vessels over there. So people tend to overreact with a head cut, and they get scared, and moms see their kids fall for the first time. But really just staying calm in any situation where anybody is hurt is really the best thing that you could do for the person that's injured, yourself, and EMS.
Got it. So you mentioned burns. So burns are a very common thing that happen in the house. I mean, unfortunately, those of us who are in the kitchen all the time burn ourselves all the time. So you want to seek professional help for any burns that cover large area of skin or on the face, groin, buttocks, hands, or feet, or have been caused by chemicals or electricity. But let's say somebody gets a minor burn. We used to be told to apply ice, but that is no longer the case.
No, it's not. So again, it varies by region and protocol, but in New York City, I believe if it's a burn that is not in one of those major areas that you mentioned, and it's less than 9% of the body, you can actually apply wet occlusive dressing, which means like if you dampen a gauze pad or something like that, you can apply it. But the problem is that you risk putting the patient into shock by lowering their body temperature if you are applying ice to a burn.
Okay. I have something at home called Biofine. I think my dermatologist gave it to me. It's a topical emulsion, and I keep it in the refrigerator so it's cold. And it's made from trolamine salicylate, which is an organic compound, which is the salt formed by combining it with salicylic acid. And they use it in sunscreens and cosmetics and things like that. And you can get it online. I'll post a link. But it's a great thing if you put your hand in the oven and you touch the pan and it's too hot, you could put this on right away. And because I keep it in the fridge and it's cold, is very nice. Yeah. You also can use aloe vera. That's something I always keep with my sunscreen bag. Yeah, because that's always good. If somebody gets a sunburn or something, so that can help too.
Yeah. Let me ask you about this. So one thing I've found over the years that I've just done, because I found it to be so effective, is like if I get a burn like on my finger or whatever, and it's like blistering and, it hurts. So is not just to run cool water over it, but actually to submerge it in water and like kind of keep the water not cold, but just like a little bit cool till like I can gradually like over 20 minutes, 30 minutes, an hour, depending, like kind of get it out without it really hurting.
Yeah, that's definitely a great idea. Again, you have to just take into consideration where the burn is.
Sure, of course. Right. There's certain parts of your body you can't do that with. Right?
Yeah, there's absolutely nothing wrong with that. If it's relieving pain, it's a great thing to have.
Yeah, so I've done that for people.
Okay, so another common thing is bee stings. So if somebody's having an allergic reaction, definitely should call 911. If they have an EpiPen, they could do that. And like you said, help them remain calm until help arrives. But if somebody's not showing an allergic reaction and we want to treat this with professional help, how would they treat the bee sting?
Okay, if somebody is not having an allergic reaction, and this is a really key thing here because obviously then that requires epi, you want to check the area. You want to see if there's a stinger still in the area that the person was stung. It's really great if you, and this is again a case-by-case basis, if it's a spider bite or a bee sting, if you're able to actually get the insect that bit you and trap it and kill it, trap it, put it in a bag separately. There's, in some parts of the country you have like brown recluse spiders and other things that might need identifying if you do have a reaction down the line, not particularly in bee stings, but in other insect stings. And you want to make sure that you remove the stinger and just treat the area with ice, make sure it's clean, dry, and monitor it. Don't just think, oh, it happened, she's fine or he's fine. Just keep an eye on it.
Right. So you want to remove the stingers. Sometimes you can gently scrape a credit card or other flat object across the skin to remove it. Then you can wash the area with soap and water, put a compress on. You could use calamine lotion or baking soda and water, make a paste. That can also help with any itching. You talked about ticks before, that you get calls for removing ticks.
Yeah, it's very common, especially in young kids. They run around. A lot of us go to the country. We go hiking in the summer. It is definitely learning to just check for ticks as a parent and a mother. That's really important. I don't think people take it so seriously because Lyme disease is a very serious thing.
Right.
Checking for ticks and then proper tick removal, being able to remove the tick without breaking off the head and not having it still attached to you is really important.
So what's the best way to do that? Or is it the best way to call?
Sliding a credit card underneath the head of the tick and kind of twisting gently. But if you're scared or if you're unsure, call a medical professional, go to your pediatrician, go to your doctor. I mean, there really is no, rather have somebody do it that knows what they're doing than risk doing it the wrong way and, further damage.
Yeah. Absolutely. Next thing really common with kids are nosebleeds. So if a kid has a nosebleed, how do we get that to stop?
Okay, so again, you want to think about the mechanism of injury. Is he having a nosebleed consistently, or is it because he ran into a door or fell or there was some sports injury? If it's because of an injury, you obviously want to check the area. You want to apply pressure to the area and have them actually just tilt their head slightly up. Pressure an area and just kind of tilting slightly up, and then obviously clean and reevaluate the area.
Right. And if it lasts longer than 20 minutes, definitely seek emergency medical care.
And just so parents know, I think one of the most common reasons younger kids get nosebleeds is because they pick their nose.
Yeah.
How do we get them to stop doing that?
Well,
can't be easy.
Yeah.
Okay, so I know there's been a ton of snow in New York, so maybe we should be talking about hypothermia, but I wanted to talk about heat stroke and heat exhaustion and what happens if that is not treated in a timely manner.
Okay, so if it's not treated in a timely manner, there's a few signs and things that you can look for. And if you see your child dizzy, faint, flushness in the face, I mean, it really depends where they are in heat stroke, heat exhaustion, dehydration. It's really good to obviously do preventative maintenance. You want to check on your kids ever so often, offer them water even if they're not thirsty, things like that. But you want to cool them down. I think actually the New York State law just changed that you're allowed to give them cool liquids. Same with hypothermia on the other case. It never used to be, but you can actually now give a hypothermic patient warm liquids to the mouth, if I'm not mistaken.
Okay.
And getting them out of the sun, and again, monitoring. If you're not sure, call for medical help. It's always the best case.
Right. So a lot of times also people will reach for the Gatorade. I'm personally not a fan of Gatorade. I don't think it's a great product, but there are a lot of other products out there that do have electrolytes in them. There's some that come like in a powdered form. You'll have to see what has a extra or not. But if you know your kid's going to be out there playing sports or out in the heat for a while at camp, it may be a good idea to have them take electrolytes on a regular basis.
Right.
Yeah. Absolutely. Again, preventative maintenance, monitoring, and just being prepared.
Right.
And also the other thing too, being realistic, like if you have any kind of drink for them, make sure that they like the taste of it. Because if they really like the taste of it, they're more likely to keep grabbing for it while they're out there, rather than you could get the best electrolyte mixture in the world, but if they don't like the taste, and it might not be that it tastes bad, they just don't like that taste, they're going to ignore it. They're not going to drink it.
Yeah. Okay, so let's talk about now sprains and strains. So a sprain is an injury to a ligament, and a strain is an injury to a muscle or tendon. So it's not really necessarily important for people to know the difference, but there is a difference. The most common symptoms of a sprain or strain include pain at the location of the injury, swelling and or bruising, difficulty bending the injured joint, or a spasm of the injured muscles. Now, again, if you have severe pain or it looks deformed or you really can't move or walk, it's probably a good idea to get professional help again. But Charna, if somebody's at home and they're like, I think I sprained my ankle, what would you recommend?
The first thing is that you're going to want to keep off of your ankle and you're going to want to elevate it. And you're going to want to see, is there a major deformity? Is it getting worse over time? You can apply ice to the area. Always have something in between the ice and the skin. You never want to apply an ice pack or ice directly on the skin. And again, just monitor it. And it's always a good idea if you're unsure, especially with kids. Kids tend to push off pain and they tend to, oh, it's fine, or I'm going to get back into it. You know, you could have a hairline fracture. There could be other things. As an EMT, it's not our job to diagnose. It's our job to say, okay, what's going on in the moment? And, you know, what can we do down the line? And as a parent, it's just a good idea to, again, keep an eye on it.
Right. Yeah, it was RICE. That was rest, ice, compress, and elevate. That's what we were always taught as kids to treat.
Right. But I want to say also, too, sometimes it's just not that easy to tell the difference, or impossible to tell the difference between a bad sprain and a break. I had that happen to me a number of years ago, where I broke the smaller bone in my lower leg, the fibula. And I thought I just had a bad sprain, or maybe I was just hoping that that's all it was. And actually, I drove myself to the
emergency room.
Not the emergency room, but the urgent care. I drove myself to the urgent care, and they were like, "You have a break." Yeah. Luckily, it wasn't
terrible.
It wasn't terrible, but they were. I was like, "Oh." So then I had to get home from there. That was interesting.
Right. Okay, another kind of minor thing, splinters. Kids are always out there playing. Moms and dads have taken a lot of splinters out. Yeah. There's an ancient lore that you'll win the hearts of the kings of the jungle by removing thorns from their paws. We all know the story of the mouse and the lion.
Right.
Where the mouse removed the thorn from the lion's paw. Right. Okay, so we want to make sure a splinter doesn't get infected, but how do we remove a splinter? Do you need to remove it? Can you ignore it? Will the skin eventually push it out?
Yeah, so if you get a splinter, or your child gets a splinter and it's visible and there's a piece of it sticking out, you can take a pair of tweezers, obviously clean tweezers. You want to sterilize whatever you're using. If you're able to get it out, great. You want to prevent infection, like you said, so keep the area clean. And I don't know if, like, as a kid, you ever got a piece of pencil or something in your skin. I know, like, your body will push it out eventually, but it really depends how big of a splinter, the area, how much rubbing is going on, and, if you're going to get infected or not. So just make sure the area is clean, and you do want to try to remove it. You shouldn't really leave it. But if worst case scenario, again, follow up with a pediatrician or see how it goes.
Right. Okay. So here's a fun one. Diarrhea. Kids do get diarrhea. We don't always know why. It's usually because the body is reacting to something that they ate, or a toxin that needs to be flushed from the system. So in some situations, diarrhea can almost be considered protective. But what we really need to watch for is that the person also doesn't get dehydrated. Right. Because that is a problem that's associated with it. So anything that you would recommend?
Again, small amounts of liquids. If you have infants that happen to have diarrhea, we went through this in my house. You want to actually, believe it or not, use gloves when you're changing them. Diarrhea happens to be highly, highly contagious. So good hand washing, cleanliness in the home. And really, just like you said, liquids consistently, slowly, nothing too upsetting. It happens to be a myth, believe it or not, to drink ginger ale, because it's the ginger that actually calms your stomach, and ginger ale typically is not really made with real ginger. So stay away from sodas and things like that. Stay away from apple juice, anything with caffeine, and stick to water. Your doctor might even recommend like Pedialyte or Pediasure. If it's really, really a problem. Right.
Nothing with high sugar, because that will make it worse. Also, as a holistic nutritionist, I would say, there are studies that show that good probiotic strains can provide great relief of diarrhea symptoms. So that might be something that you would want to explore. Also, Pepto-Bismol is good also to help with diarrhea, especially if you're traveling. Usually they recommend to keep Pepto-Bismol tablets with you. But you were talking about ginger, which is a great segue to I think the last one we're going to talk about is nausea, which actually comes from the word nautical, from the seasickness.
Oh, from seasickness. That makes sense. Yeah.
People used to experience. But ginger is great with easing nausea. It's a very popular remedy. Yeah. Okay. So for nausea, besides the ginger, we also could do peppermint aromatherapy. By the way, if somebody's pregnant, definitely talk to the doctor before trying any alternative things. B6 actually helps with nausea too. People wear C-bands, which are the bracelets that sit on an acupressure point on the wrist, which help too. Oh, I did have one more. Choking.
Oh, very good.
Yeah. Right.
Okay, so I'll just jump right in here because this is something that we see a lot of. And I think one of the most important things, I keep telling my husband this at least, if you hear a child coughing and choking, leave them alone. It means that air is actually going into their esophagus. It is actually the silent choking when we do that universal symbol where we cross our hands over our throat and the person cannot get any air and there's not coughing. That's when a child is really, or a person is really in need of the Heimlich maneuver. Or if it's an infant or smaller child, you could do back blows, really hard back blows to the upper portion of the chest. And with infants, you want to flip them over, see if you can actually see the item, things like that.
Right. Yeah. And you can, an infant or small child too, you can like turn them up, not upside down exactly, but sort of like angled down, and you can have your forearm supporting them and then do the back blows. It's very, it can be very, very effective.
A lot of times we hear people coughing and we think, oh, we need to like pat their back or just, leave them alone. If they're coughing and struggling, they're breathing.
Right.
Okay, so we talked about first aid kits, before. So I want to talk about a little bit about what everybody should have in their first aid kit. I mean, I have, because we live in California, it's an earthquake area. I have a first aid kit. I have my emergency earthquake box. As a matter of fact, when COVID started and we were looking for masks, I opened up my earthquake box and I actually had N95 masks. I actually had latex gloves. I had Clorox wipes and Purell. And my husband's like, oh my God, like, how are you so prepared? But we need to do that because of where we live. So what are some of the things, Charna, that either people can buy the first aid kits? I have one in my car called Ready Freddy, which has a lot of supplies in it as well. So you can buy them, but a standard first aid kit you can put together. I also have arnica. Mine, I want to point out, arnica is a homeopathic remedy. If you have little kids and they're always falling and bumping and bruising themselves, arnica is a great remedy. So what do we need in our first aid kits?
You definitely need some antiseptic, something to clean if there's a cut or a wound. You want to think about different size Band-Aids and bandages. You might want to get a soft roll bandage, just to have in there with the clips. Definitely gloves. Gloves are helpful. N95 masks in today's world and range. While that's seen as a medical grade professional mask, if you're going to get an EMT kit, or you're going to get a first aid kit, you just throw it in there. Some kits come with splints, like finger splints, a lot of jam fingers, things like that. It really depends, how, expansive you want to get. You mentioned you live in California with, earthquake kits. In New York. It's, more like we had the snowstorm. Okay, we needed extra water around and flashlights. I mean, flashlight, even though it's not necessarily seen as a, first aid necessity, it really is, because if you have an injury and there's something and you need somebody to see, it's a good thing to have. Yeah,
absolutely. It's also a good idea to have the names of your doctors, emergency contact numbers, prescribed medications, like maybe 3 days of medication if you take it, just so that you have everything there.
I think one of the important things is for people to maybe, once every so often, depending on your schedule, but at least probably once every 2 months, once every 3 months, look over your kit and make sure things haven't expired, things are updated, things aren't like falling apart. And after a while, I mean, even things that you think you can keep forever, adhesives start to wear off or not, and keep it focused and keep it stored in a cool place, not like where it's going to get hot.
Yeah, absolutely.
Yeah. Okay. So the final thing is, I'm sure you need to also remind people to be careful to avoid direct contact with blood, vomit, other body fluids, especially now in the era of COVID. That's an important thing to remember as well. Right. And in many cases, basic first aid can help stop a minor situation from getting worse. But as Charna said, you don't be afraid to call for professional help if you need it. Charna, thank you so much for joining us.
Yeah, thank you for having me.
Yeah, we really appreciate your time, and I hope people learned something.
Yeah, absolutely.
Okay, bye.
Bye.
Right now, Ezras Nashim is raising money for radios, medicine bags, and oxygen tanks for the 20 new EMTs who just came on board. So if you'd like to make a donation, you can visit them at ezrasnashim.org. JillH.org. I also want to remind you to follow me on Instagram at Jill H. Scharfman, and I want to thank our engineer Mike Casantini at the Network Studios. You can also find us now on Schmoozy, a new social media app where you can listen to full episodes of our podcast as well as join our forums for a deeper dive into our episode topics. And that is it for this episode of Let My People Eat. Please visit our website at letmypeopleeat.com and leave us a comment. Get in touch with our email at podcast@letmypeopleeat.com or call us at 317-659-0004.
We are also on Facebook. Search for Let My People Eat podcast to join the discussion. You can ask questions and suggest topics you'd like us to talk about in future episodes.
If you like this show, please make sure to leave us a 5-star rating and review on iTunes and tell your friends and family to subscribe to us on Apple Podcasts. Let My People Eat is proud to be part of Jewish Coffee House, where you can find your fill of stimulating podcasts dedicated exclusively to Jewish content.
Please remember that while we are certified professionals, this is not a medical advice podcast. No content, posts, or comments should be interpreted as professional guidance. Always speak to your own doctor about making the right life changes for you.
Until next time, I am Jill Scharfman.
And I am Andrea Moskowitz.
Thanks for joining us, and go in good health.